Suburethral slings. Beware of complications.
I had several women who reported the same thing to me: pain in the lower abdomen, in the lower back, pain during intimate relations, the inability to have relations. They had one thing in common, and I realized this a little later. They had all undergone surgery for urinary incontinence problems. And so a kind of small tape is placed under the urethra, which is the canal that allows urine to be evacuated to urinate. And I did my own research, first simply for my personal medical knowledge, so I delved a bit into the subject, and that's when I discovered the scandal of the suburethral slings. It must be noted that these slings are no longer implanted in several European countries, notably Scotland, England. They are also no longer implanted in Australia. In France, it was the subject of a debate in Parliament, increased monitoring by authorities, and there are currently thousands of trials, complaints ongoing. In Belgium, it is talked about very little, if at all, and these women were not aware. Before the surgery, they were told about the possible short-term consequences after the operation, the classic surgical complications, but at no point were they told that they might have problems in their relationship, etc. And it sometimes has catastrophic repercussions on their career, because due to the pain, some can no longer walk, move, or work. Their family life, their life as women, was also heavily impacted, not to mention their mental health. And so for these women, what I ask is simply that if we must proceed with this kind of operation, then it should be explained to them. It is not normal that women in Belgium are less informed and especially not listened to or heard when they complain about these things. Today, for the most part, they have to go to the United States, spending between 20 and 25,000 euros at their own expense to undergo surgery again and hope to regain a normal quality of life. What they were not told is that once these slings are in place, it is almost impossible to remove them. So I'm taking advantage of this short video to alert patients who have had surgery and are suffering from pain issues or things like that, or those who are considering this type of surgery. Take the time to get informed, ask questions to your gynecologist, your urologist. And if you ever experience these after effects following the operation, you should be able to discuss them directly with your doctor.